Hello, my name's Ashley Shaw from Frisco, Texas, and today I'm going to be talking about COVID and how it impacted me and the lessons I learned from it. COVID impacted the end of my sophomore, my junior, and my current senior year, and I just wanted to talk about a little bit of things that I've gone through. So I think the biggest thing that has been impacted by COVID was school. I mean, all the schools ended up shutting down. It was a huge mess. And part of that was teachers now had to create online lesson plans. This really affected stuff like the science classes the hardest because they're very lab-based. And I ran into this issue in medical microbiology. Medical microbiology is a very lab-based class. We hardly ever do any lectures. We spend all the time in the lab, back to back to back. And I remember when this whole thing started, my medical microbiology teacher freaking out because how was she supposed to turn this class into an online class? There aren't any online labs for medical microbiology. And so 3 of the teachers that all taught medical microbiology and a huge group of students that just happened to be there at the time, there's 5 of us, and I was one of them, we all sat down and we tore through the normal lesson plans. And we were like, okay, well, we could do this for S. aureus. We could do this for viruses. It was very interesting to work with and see trying to make a lab-based class a lecture-based class. And it taught me a lot. I ended up having to do the same thing for pathophysiology. Even though that's more lecture-based, it was still a huge struggle to try and get everything together. And seeing the teachers running around freaking out, not knowing how they're going to teach all the proper information. Even though we weren't an AP class, we didn't have an AP test to study for, we still needed all the information. It's a prereq for the higher level courses, and so it was very vital that we got it all in. I think that one taught me patience the most. I had a lot of people complaining about the teachers during the online portion of our school year, and I was like, y'all, you don't know the crap they went through to create your lesson plans. How long they stayed up, because they didn't get aid. They didn't get help from, maybe they got help from their other teachers, but they were kind of on their own, and getting a firsthand experience in that was really neat to see. I think the other one was definitely misinformation. It's kind of a running joke around this school that I'm the doctor. Everyone comes to me for medical stuff. It's always been that way since freshman year. And with COVID, that was no exception. I had people coming up to me, people I had never met that just had heard of me, asking me questions about COVID, like if they were gonna die, if their families were gonna be okay, how the economy was gonna work. All of these different things. But the biggest one had to be the masks. And I have asthma, and I understand breathing through a mask with asthma. It's not easy, but I wear my mask. I took it off to record this video, but I have my mask on me 24/7. And seeing kids just being like, oh, I don't want to wear a mask, like it's not going to protect me, like all these complaints really opened my eye, especially because I would be in my clinical rotation in the morning at the hospital during COVID, and I would go in and vents. People were on vents everywhere. There was no happy time during COVID. And to go from working with 12 patients that are on vents that are very, very sick, not knowing if I'm going to bring that sickness back to my school. There's immunocompromised kids that go to my school. I have to be very careful. I have immunocompromised teachers, and those teachers have parents that are immunocompromised. And knowing that I could bring that back to my school and actually end up hurting someone because of it was really hard. But the other aspect of it was going back to my school and seeing those people that complained about not wearing their masks because it itched. It was uncomfortable, and it was really rough. I'm not gonna lie. Seeing freshmen complain with no valid reason after I just put someone down the road, had to talk to the family about a death, and it was very eye-opening. I like to think I handled the situations that I ran into well when they dealt with masks, but it was really hard. I'm not the CDC. I don't have all the information, and so even teachers coming up to ask me information, I was like, well, this is what I know, but I don't truly know everything. I just wear your mask and do as much as you can to protect yourself. That was really all I could say, but it was definitely very challenging. And I mean, that one also taught me patience. It really did, trying to sit down and talk with people that know the government did not release COVID-19 and no, it's not nanobots that are in your bloodstream and will kill you. It took a lot. It also took a lot of research and extra time on my part just to get everything down correct. And it was very interesting to work with. And stemming from that would have to be the work-based programs at what is called the CATE Center, which is the Career and Technical Educational Center, which I like to call my second home because it basically is. I'm there all the time. And at the CATE Center, we have these work-based programs. I'm in one of them. I've actually been in 3 of them in total. But they were impacted very hard, especially mine, because we were out in the hospitals and the nursing homes. So beforehand, your normal hospital would be the ER, med-surg, women's services. During COVID, there wasn't any of that. I remember one hospital having the women's services and the COVID unit right next door to each other, which was very eye-opening and very frightening for many reasons, but they didn't have any room to put them anywhere else. And I mean, it was horrible. I remember having patients in the ER I had to turn away because we didn't have the beds available for them, or we had to transport someone out because we could not take care of them anymore. And everything else going on, I mean, every person with a cough was considered COVID. Any person with any symptom was considered COVID, unless you had something obvious going on, like chest pain, which even at the time was a COVID symptom. So we treated everything like COVID. I remember going through tons of PPE gowns. I must have gone through 20 masks. It was a nightmare. And I mean, just not knowing if we're going to bring it back to our loved ones was a huge thing. It was also really difficult for some of the other kids. It's hard enough working. I worked on the neuro ICU, and I've worked on the ICU before. I've also worked NICU, which is neonatal ICU. It's not fun. It really isn't. I'd love to say that all aspects of healthcare are fun and that the medical field's so glorious and you get all these fun cases, but it's not. And COVID really brought that point forward. And I actually had a personal experience with that. I did a private home health little side gig for about 2 months. And it was because I knew the person whose mother needed a peritoneal dialysis machine set up every day for her because she wasn't able, if you look at the bag, there's a little tab at the bag and you snap it off. She wasn't able to kind of set up her machine. And so after school every day, I would go over there and set up her machine and just do some other stuff for her. Take out the trash, any basic stuff she needed help with. I mean, I was happy to do it. I had nothing else to do at the time, and the experience was really amazing. And then one day, her neighbors were having something done to the house, and they had to cut the power. And I'd set everything up and went to turn on the machine, and it didn't work. And I was like, this thing can't stop working because you can't go without dialysis. That's very dangerous. That's incredibly dangerous. In fact, that's how most dialysis patients die, is because they don't have their dialysis. But it was supposed to be fine. She was going to turn on the machine later. That's all she had to do. She went 3 days without dialysis and ended up getting COVID on top of that. And we don't know if it's from me bringing it from school or from her daughter, who is a teacher, bringing it from school. So that was really difficult. I went from just going there after school a couple times a week to I went over there every day with full PPE and N95, and it was really hard. And those 2 days of dialysis made a huge difference because she ended up in the hospital and she didn't make it. So she actually passed away from COVID. But seeing that firsthand, not just entering in the hospital and being like, oh, these are my 12 patients for the day, actually working alongside someone and seeing that process was really eye-opening. And I like to think it changes the way that I interact with my patients now. For sure, I look at it through a new eye. I definitely see the empathy side of it before that I didn't really kind of see. I saw it, but it was more, people get sick. And with this, it was like, this was out of her control. She never left her house. And it was interesting. So it definitely impacted the way that I interact with my patients. It also impacted the way I interact with my students. And I say my students because we kind of took the younger medical students under our wings. And for mine, I have a little kid that I train, and he got his CNA. He's actually taking his test right now. And just working with that, going through the nursing homes, I remember after her death, we would have patients that were on the line, like any moment they could go, and I remember taking those. I assigned myself those patients because I had the experience of having a patient death, and so it was easier for me to take it than another CNA that had never experienced that before, because at least I had already experienced it, so it wouldn't hurt someone else. So it definitely impacted that, and COVID really impacted our programs. We lost hospitals. They couldn't risk us getting sick. We were considered the future at the time. We didn't know what was going to happen. Thankfully, a lot of them have opened up now. I still get COVID patients though, and with flu season coming in, I'm about to start having a mixture. And with the influx of pediatric patients, I'll probably have more pediatric COVID patients, but it was really a tough time. But if I had to sum up this video by the lesson I learned, it would be patience and empathy. And knowing that there is a light at the end of the tunnel. I thought COVID was going to be a thing forever. And you know what? It might be. It might be like the flu, where we have it every year. But at least it has slowed down to this point. I remember everyone panicking. We were out of vents, and we would have patients that needed vents, and we could not give it to them. And we would have to ask other hospitals and beg for vents, and they didn't have vents to spare. And so it was a really difficult time, but I would definitely say patience. Just through all my experiences, and I had patience, but definitely through this experience I gained more of it, and just empathy. You don't know what other people are going through. After that home health patient died, I came to school the very next day, so definitely empathy is a big one. And I mean, obviously you need that in the hospital, but even for stuff like school, even for the teachers, stuff like that, it's good to have. And the light at the end of the tunnel is just a very big one for me, because we're kind of at the light at the end of the tunnel, but I'm glad, and we're going to keep moving forward, and I'm excited to see what happens.